Community interpreting is a very young profession, and it has grown out of the concern of people from their own communities to serve other people in their own communities, to help people get access to services. So what you start out with is a whole bunch of very well-meaning people trying to do good by trying to interpret. And when these people have never received any interpreter training, they tend to be, and as research has shown, they tend to be highly inaccurate. They add things in, they leave things out, they give their own opinions, they polish things up so they're a little nicer. They make big mistakes, and they find themselves in situations that they are way over their heads and they do not know what to do. That wouldn't be such a problem, except that it ends up, especially in some community settings, for being not only serious but sometimes even fatal. So you can easily imagine healthcare settings in which an inaccurate interpretation can lead to the wrong diagnosis, to inaccurate treatment, to non-compliance with a treatment plan. You can easily imagine in a courtroom or in a legal setting how inaccurately interpreting can lead to the wrong evidence, leading to the wrong judgment, leading to an inappropriate sentence. You can easily imagine in an educational setting how inaccurate interpreting can lead to a child being inappropriately disciplined or not getting the support that their child might need to be successful in school. So sometimes the implications of the poor interpreting can be very, very serious, and as I say, in the healthcare setting can even be fatal. So how do you help these people who are good-hearted and want to do a good job to be accurate, to be able to understand their boundaries, to understand what their role is in the team that is supporting that non-English speaking or limited English proficient person? And training is what has to happen. People who are not bilinguals or who are not interpreters often underestimate the difficulties in interpreting, the complexity of this work. This is a complex cognitive process of understanding a message, extracting the meaning, and then trying to recreate that same meaning in a different linguistic and cultural context instantaneously. And that is not a simple process. In addition, there are, as in any profession, there are ethics and standards of practice. There's an enormous amount of vocabulary. I mean, if you consider all the vocabulary from social services to all of healthcare to all of education, it's kind of mind-boggling how much difficult vocabulary interpreters in community settings are asked to deal with. And in addition, there are in community interpreting, in community interpreting, interpreters do not enjoy the formality of a courtroom that protects them and defends their role. They do not enjoy the anonymity of the interpreting booth that conference interpreters have. They do not enjoy the, let's say, the deniability of being a diplomatic interpreter, where really it's not their responsibility what is said or whether everybody understood it. It is really very much the participants that are managing everything. In community settings, interpreters are very much right there in the face of the people with whom they're interpreting. They can't be invisible as much as we'd like to say they are. And they find themselves oftentimes caught up in some of the most difficult experiences of human existence: birth, death, bad news, disability, unhappy home situations, refugees and immigrants having to try to accustom themselves to a completely new system, or many, many completely new systems. And the interpreter is right there, right, with no role protection. And so to be able to know one's boundaries and to know how to handle the difficult situations that come up is very tricky, and not something that interpreters in other venues actually have to deal with much. So we just throw people into this with no training. We set them up to fail. But even worse, when they fail, we fail, because service providers can't provide services to language English proficient populations without effective interpreting. And communities can't access those services without effective interpreting.